Hello, everyone, and welcome to the Down Syndrome Center podcast. As always, I'm your host, Dr. Kishore Balodi, and today we have a return guest, Dr. Peter Bulova, who is also part of our Down Syndrome Center. And so this is a really exciting time for us to share information from our center to all of you. Dr. Bulova, I'll have him introduce himself here in a moment, but he does run our adult Down Syndrome Center. And so he was an expert guest for today's topic, which would be on Alzheimer's disease. And so before we get too far into this podcast, Peter, I hope you would be able to introduce yourself, tell us who you are, what you do, and why you love working with this population.
Sure.
Yeah.
Once again, thank you so much for having me on. This is such a wonderful opportunity to get to talk to people about one of my favorite topics, talking about adults with Down syndrome. This is a tougher topic today.
Yes.
But I'm hoping that I can help people a little bit in just ways to frame it. So I have been working with adults with Down syndrome since 2003, and I run our adult center. I see people once a week. I don't think I knew what to expect when I started, and I don't think I really appreciated how lucky I was to have this chance to work with adults with Down syndrome, probably until I went to that first national conference. There was just so much life and joy and living in the moment in all of the people that I saw there. And I think it's something that everyone can learn from. And I think I've taken so much from that. And I still remember going to a Colby Calais concert, which the Global Down Syndrome Foundation put on just for the conference. And I don't think that she expected that the entire audience was going to get up and start dancing about 5 seconds into her concert and just stay on the floor the entire time. It was really wonderful to see.
Wow. You know, and I think for our listeners to understand, especially for those of you who are local to our Western Pennsylvania area, it's pretty rare for us to have an adult Down syndrome center. I mean, it's a rare thing in this country, in this world, really, to have. And so for us to have Dr. Bulova here with us is really exciting. And so Peter, one of the areas that often comes up, and I'll tell you, even from my medical school training, which feels like it wasn't that long ago, but I suppose it was, we talked about Alzheimer's disease and Down syndrome quite a bit back then. And there's a lot of things that were misconceptions. So I'm hoping we're going to be able to address some of that today. How about start with this? What is Alzheimer's disease? What causes it? Who gets it? Those kinds of things.
Sure. So Alzheimer's is a specific form of dementia, and it's caused by the buildup of amyloid protein in the brain. About 60 to 80% of cases of dementia are Alzheimer's. So all cases of Alzheimer's are dementia, but not all dementia is Alzheimer's, but most are. It's a syndrome of memory loss is the major thing that you'll see. So at first, it prevents new memories from being formed or new information from being processed. It's then followed by loss of older memories and then a significant decline in skills. I think that early on, the things to look for is that it presents with behavior changes, and then a loss of skills, things that people seem to that they would do every day, and then they stop having interest in doing them in the same way. The later stages, you'll see this loss of abilities to do most activities of daily living. It can progress to people forgetting how to eat, how to swallow, and then things like people that were very verbal can have their vocabulary completely lost. Speaking more 1 to 2 word sentences.
So that's, I mean, boy, quite a dramatic change for the person and for their family, loved ones, caretakers, and so, with somebody with Down syndrome, we talked with Dr. Santoro on a previous podcast about regressions in Down syndrome. It's very similar in that feel of suddenly somebody who's not able to do something that they were able to do before. But Alzheimer's disease, as we're going to be learning, I'm sure, during this podcast, is a different entity than that regression that we were talking about with Dr. Santoro. Do we feel that Alzheimer's disease, is it more common in Down syndrome? And if so, any speculation as to why that might be?
Yeah, so there's 2 things. The one is that we see early aging in many of our adults. So we'll see early cataracts. People might develop cataracts in their 30s and 40s instead of in their 60s, 70s, and 80s that we might see in people without Down syndrome. And we see arthritis at a very early age. There are some signs of early aging. The second one is what you will always hear about if you read any article, or it has to do with the precursor to the amyloid protein, which is found on chromosome 21. So the people with Down syndrome just have more amyloid, and so they deposit at a much faster rate. It looks like people start depositing amyloid 15 to 20 years before they ever develop any symptoms.
And I think what I remember from that medical school textbook is reading that it said everybody at the age of 40 with Down syndrome will have these proteins and plaques and things like this in their brain that look like Alzheimer's disease. And so my medical school textbook said that 100% of 40-year-olds with Down syndrome will have Alzheimer's disease. And so my question for you is that true? And if not, how young do we start to see Alzheimer's disease in people with Down syndrome?
Okay. I'm so glad you asked that question, because I definitely want to clarify. I remember at a conference that a father got up and spoke in front of all the medical professionals at a meeting, and he said, "My daughter's 11, and I can't stop thinking about Alzheimer's, and I'm so worried that she's going to develop it." And you could just feel it in the room, how everyone was thinking, this is definitely nothing to worry about when your family member is 11. It's something that presents much later on. We really don't know how the medical science is going to progress, and really just enjoy every day with your family member, or your friend, or the person with Down syndrome in your life. What we'll see, so to give you context, in the those without Down syndrome, about 15% will develop Alzheimer's by age 65. And then that goes up with age. So by age 85, it goes from 15 probably to about 30%. So in Down syndrome, we try never to make a diagnosis before the age of 40. And then even that time from 40 to 50, the risk is probably about 10% of people will develop Alzheimer's by age 50. So very rare that we see it even at age 40. It does go up a lot faster once you get to 50. So probably up to about 10% of patients by age 50. And then as you get up to age 60, it's closer to 60%. The average age of onset is probably about 52.
Okay.
So that's when we'll start to see the rises in that 50 to 60 year group. It does go up after 60 also.
So it's definitely, like you said, an earlier onset than in the typical population, but certainly not as early, perhaps, as previously thought.
Exactly. Yeah.
Okay. All right. And then I guess if you're a family member, with an adult with Down syndrome in your home, let's say, and you're wondering, are these signs of Alzheimer? What would be some things that you would say, yeah, this would be something to bring to the attention of your caregiver, your medical provider, if you're seeing in your loved one with Down syndrome?
Sure. So there's several things that you should be looking for. And again, we start screening at age 40. So these are not things that you're looking for being Alzheimer's if it's before age 40. And there are lots of other things that can present with many of the things I'm about to mention. So for example, we always look for gait changes. So changes in difficulty initiating walking, shuffling gait, changes like that. Now, of course, I just told you that the risk for arthritis goes up dramatically at the same time. So we have to try to make that differentiation. We'll sometimes see urinary incontinence, and it's not an urgency or difficulty getting to the bathroom, which can happen to very, very many people. It's more of less interested in getting to the bathroom in time, just not caring as much about having incontinence. A major behavioral change is probably the first sign. And the ones that are more commonly Alzheimer's as opposed to a medical issue or depression, the ones that fit Alzheimer's more would be things like apathy, people that just don't care as much as they used to, social withdrawal. And then the one I look for is a loss of empathy. I mean, so many of my patients have such a high emotional intelligence. They can really read the room, they know how people are feeling, and they react to it and respond. And often you will see a loss of that in people that have Alzheimer's. You're looking for a personality change, confusion in very familiar situations. So someone that was setting the table and they really start to forget that they need to put out silverware with plates, major changes like that. And then a loss of interest in cognitive activities. So someone that used to like to read, and now they'll just watch TV and they don't even care what's on TV. They just, if TV is on, then they'll watch it. So we have gait changes, urinary incontinence, major behavioral change, and the last one is seizures, and that's a pretty significant sign. Anyone who's developing new seizures late in life, concerning for Alzheimer's.
Okay, yeah, and definitely a lot of those things are going to be quite shocking, I would assume, for the family to see. And so I think those are great red flags for us to be aware of, for our listeners to be aware of, to look for their loved one. I guess a question that comes up from families is, are there things that we could be doing to perhaps prevent those things from happening? You'll see a lot of things on the internet, you'll see nutritional or medical or things that people will say, if you do this, if you have them exercise their brain more. What are some of the things that or perhaps are known to be preventative treatments or techniques to keep Alzheimer's from being from occurring?
Sure.
Yeah.
So I'm looking, the trouble with Alzheimer's is that it's a deposition of protein, and there isn't much that you can do to exercise the brain that's going to prevent that deposition of protein. It won't change the actual structure changes that we're seeing. So what I really focus on is, how can you promote a healthy brain environment? And that means nice high oxygen levels. And the best way to do that is exercise, healthy diet, and then treating medical issues. So anyone who has severe obstructive sleep apnea and has low oxygen levels because of that, it's going to make these kinds of progressions much more noticeable at a much earlier age. And then it seems that stress does play a role. So whatever you can do to help prepare the person that you care about for stressful events that might come up. So we'll often see progression that occurs when somebody moves from a family home to a group home, if they don't have any preparation for that to happen. If they lose a parent, those stressful moments seem to speed that progression to Alzheimer's. So anything that you can do to just kind of soften those really stressful events seems to be helpful.
And then what about after the diagnosis is made? That they have Alzheimer, or they're showing the earlier signs of it. There's always news stories and headlines that might, tout this particular drug as being the next big thing. We've seen it in specific publications related to Down syndrome, drugs that have been thought to be, hey, this is the medicine to give, and then maybe it doesn't turn out to be that way. Are there current treatments or future treatments on the horizon that you're aware of that might be able to be used?
So in terms of medications, there are always new drugs in the pipeline. I think there have probably been 100 or so that have been tried, and there's so much research going on at this moment. So definitely the next 10 years, I'm expecting there to be some major breakthroughs. It's really exciting. Even in Pittsburgh, we're doing a study, the ABC-DS study, which is a biomarker study where we're looking at, are there medications that might help? Are there ways to detect dementia at an earlier age? So we're definitely seeing a lot of optimism going forward. I don't have as much optimism for what's present right now. So for people without Down syndrome, there are several drugs that are approved. The trouble is that they don't modify that structural change. They don't change that deposition. So these are drugs like donazepam, which is Aricept, memantine, which is Namenda. And actually, there was a study in adults with Down syndrome using memantine or Namenda. They tried it both preventatively and also to treat dementia. And this study was done by the drug company that makes the medicine. And despite that, they said this medicine really didn't help. And in fact, it might be harmful in some cases because it caused some more behavior changes. So those didn't seem to help very much. There is a new medicine that was just approved, which is exciting in that it's an antibody against amyloid. So maybe it would actually have something to do with amyloid itself. And it's pronounced aducanumab. It goes by the name Aduhelm, which is Aduhelm. The trouble with this one also is that in the studies that were done, not very promising. And none of the patients in the studies had Down syndrome. And we don't know how it would affect people with Down syndrome. So all of the major national organizations reviewed the data and did not recommend it for people with Down syndrome. And also there were some pretty significant side effects to it, like brain swelling, microhemorrhages within the brain. So it's definitely a step in the right direction that we have an idea of an antibody that might actually treat the amyloid itself. And there are many more drugs coming in the pipeline.
And I think from what I've heard from young folks, young adults with Down syndrome, one in particular, I'm thinking where he went and spoke in front of Congress and he said the answer to the solution to Alzheimer's disease is found right here inside my brain. And I think it's one of those areas where when people talk about how loving people with Down syndrome often are, I think one of the other areas that we need to think about is because we know that there's a higher incidence of Alzheimer's disease in people with Down syndrome, that it's true that perhaps finding what it is on that 21st chromosome that you're saying all these different drugs and medications that are being brought up, it makes me wonder, is the answer going to potentially be there because a friend with Down syndrome might be able to give us that clue? What are your thoughts? What do you think on that?
That gives me chills when I hear that.
It does, right?
Really amazing. There are some amazing self-advocates out there, and I completely agree that this is a great place for us to try to see are there ways to prevent, to diagnose, and to treat Alzheimer's dementia. And there's so much good research going on right now, and I can't thank the self-advocates enough that are willing to be a part of this.
Yeah.
And I've heard, just as you said, these really heartfelt speeches. That really means a lot.
Yeah, for sure. Well, Peter, I think we've done a pretty good overview, as much as you can on a short podcast like this on Alzheimer dementia. Is there anything that you would think that we need to add, or any kind of summary that you would want to give us as we close this podcast today?
Yeah, I just a couple other points I wanted to make. So the Alzheimer's does tend to progress faster in people with Down syndrome, so it is something to watch for. And as we said, there aren't good medications for it, but that doesn't mean that there aren't things that we can do that help people's quality of life that do have Alzheimer's dementia. And the things that seem to help the most is having a small group of dedicated caregivers, to have anchors, things that really mean a lot to the person that has dementia. And focusing on that, I find that words are not as helpful to talk to people that if they're having issues with confusion. But there's some things that really stick in the brain well beyond other things like words. So, for example, if you can find music that your person enjoyed when they were much younger, it stays with them a lot longer. Pictures are worth 1,000 words. Totally find that true. And then anything that keeping the person's, they tend to be very schedule oriented. So having predictability and consistency are so helpful for them.
That's really great. Thank you for sharing that, because you're right. While there may not be a pill to take to make things easier for the family member, there's definitely those small things we can do to help make their life a little bit easier for them in that time frame. So thank you for sharing that.
Just make sure the caregivers take care of themselves. That's
yes.
The last thing to say.
I love that. That's a good idea too. Yes. Well, Peter, thank you so much for joining us again on the podcast. You definitely are a friend of the podcast, as you've been on now several times, and I appreciate you sharing your knowledge with us. For our listeners, I think, as we've been saying over the last many podcasts, the philanthropy that we get through to the center from listeners, from people like you, is what allows us to do what we do. We certainly would not have an adult Down syndrome center, let alone the pediatric services that we're able to provide, if it wasn't for philanthropy. So if you'd like to join in and be a part of what we're doing, and be a part of some of this research endeavors that are going on that could potentially help your loved ones as well, please do take a look at www.givetochildrens.org/Down Syndrome Center, and we would love to have you join on board with us. But until next time, bye-bye.